First, we must discuss sitting and working. In this new age of computers, cars, and desks, the cores of our bodies are becoming weaker and weaker. Our spines are paying the price. You must be aware of how you use your body. For example, when you are sitting at work at your desk, your head, neck, shoulders, and your back have to be in straight alignment to each other. Your knees have to be at 90 degrees, while the bottom of your feet have to be flat to the ground. A good posture will maintain the proper alignment of your vertebrae, the nerves, and the muscles of your body. Oftentimes, we see work postures and ergonomics that are simply inadequate and lead to many pain issues. For example, the most common problem that we see at work are chairs that are simply too high off the ground for most workers. When this happens, your knees are no longer at 90 degrees, and this type of work posture causes an excess forward motion of your shoulders and subsequently your head. It leads to overwork of the muscles of your neck, your shoulders, and your back. Remember, as we said before, for every inch that your head comes forward away from proper alignment with your spine, you are increasing the load to your neck vertebrae and your shoulders by 10 pounds per inch. For example, in this particular case, Liz has actually increased the weight of her head on her vertebrae of her neck by over 20 pounds by sitting in an incorrect position in her chair as she is working. Once you have addressed your postural and work problems, you must start to pay attention to clenching and grinding. At no time during the day or night should your teeth be touching, not even when you chew your food. Every hour on the hour, you must remind yourself of proper posture and how you work and how you sit and how you compose your body. Third, you must understand that a regular exercise program must include core strengthening as well as stretching exercises. Let's summarize again the basics of posture and working. First, we must address how we sit and how we work throughout the day. Next, to make it a habit, we start to do certain stretches throughout the day that help us to maintain our posture and also to help us relieve some of the tension in our neck and shoulder muscles. The first of these exercises is a simple side stretch where you grab the underside of a chair and with the opposite hand you pull your head straight to the opposite side. As you're doing this exercise, you will want to breathe in very deeply, air in through the nose, hold for 10 seconds, and then release the air. You will do this for 10 seconds to a repetition of 10 times on each side. We recommend that this particular exercise is done at least once per hour while you are working. Number one, it helps you to stretch. Number two, it reminds you to get back into your good posture. And if you do it 8 times during a work day, you will gain significant improvement and you will see very fast recovery from any muscle tension problems in your neck and in your shoulders. Let's do the other side. And as you can see, we take a very deep breath, hold it for 10 seconds, and we stretch the head and the neck muscles and shoulder muscles straight to the side. Again, we do this on a repetition of 10 times, holding the stretch each time for 10 seconds, and we do this every hour on the hour as much as possible. Another common stretch that we recommend to our patients every hour on the hour, or preferably when they stand up from a chair, is called a bend backward stretch. So for example, as soon as you get up from a chair, you place your hands on your back, interlocking them together, and you perform a backward stretch. This stretch will bring your shoulders back as far as possible while bringing your chest forward and realigning the posture of your head while taking a very deep breath. You can hold this stretch as long as possible and as long as you can maintain it. Again, we recommend this stretch as often as possible in order to see quick and fast benefits. So now that we have covered some basic stretches, you can certainly gather more information on your own about additional type of stretches. What is important to realize at this point is that only muscle strengthening will get your posture under control and provide the type of support that your head, shoulders, and the rest of your body require. For example, at the sporting goods store, you can purchase a yoga type of ball. Many of these actually come with a full set of instructions and full set of exercises on the various type of motions that you can do. For the purpose of what we are teaching you, we are about to show you some basic exercises to help strengthen your core, bring your shoulders back, and realign your head and neck area. For example, simple bend backs by using only 3 of your fingers, actually your thumb and 2 fingers on the floor, and raising your head and shoulders away from the ball by keeping your chin tucked in so that your head alignment is straight, doing between 10 to 12 sets of these exercises, 10 to 12 repetitions, anywhere from 2 to 3 sets, will provide some strengthening to the lower back muscles and allow you to improve your posture. Most of us have very weak lower back muscles, which can lead to the hunching and the forward head posture that we showed you previously. Along with this exercise, additional fly type exercises with arm and leg extensions can be done. Again, repetitions of 10 to 15 on each side, 2 to 3 sets per day. Doing these exercises a minimum of 3 to 4 times per week will help to strengthen your core muscles of your back while bringing the shoulders, the neck, and head into better alignment. Remember, it is the muscles of your back that maintain the posture. It is the muscles of the upper shoulders, neck area that keep your head in good alignment. Without strengthening your body, without strengthening your core, without strengthening your lower back muscles, proper posture is simply not possible. Chiropractic adjustments, other physical therapy exercises, injections, ultrasounds, TENS units, and many other treatment modalities are simply not going to work if the patient does not make themselves go through various exercises that provide these type of strengthening. Another common exercise that you can do in the convenience of your home are exercises to be done with elastic bands that again you can purchase at the sporting goods store. Your simple door in your house and the handle on your door can serve as the fulcrum point to tie one of these elastic bands and start doing some of these exercises on a daily basis. For example, a row exercise is a very simple and effective way of strengthening your back muscles. What is important to remember when you're doing this exercise is that you want to keep your elbows tucked to your sides and not allow your shoulders to hunch up. By bringing the shoulders down and back, as your arms pull backward, we are strengthening the muscles of the scapula and the upper to middle part of your back in order to hold your shoulders back by strengthening these muscles. Another easy exercise that you can do throughout the day is an exercise that helps you to stand straight by putting your body in alignment with a doorway or a wall. Making sure that the back of your heels are against the wall surface, your lower back being against the wall, as well as your shoulders and the top of your head. This is a very simple method of retraining and reteaching you where your posture should really be. Now, I'm sure that you are going to walk by at least 100 walls during the course of one day. Take at least 10% of those walls and stand against the wall. It's as simple as that. If you maintain this for approximately 2 to 3 minutes, and then slowly walk forward a couple of steps, maintaining that particular posture, you will realize and you will reinforce yourself with what you need to do to straighten out your posture from your head to your toes. One of the most common problems that we see when we evaluate patients that have undergone certain physical therapy programs is the fact that the patient is being taught how to do these exercises incorrectly, or the patient may forget how to do the exercises correctly. For example, even the row and the fly exercises that we have given you on this video today can be done incorrectly if the patient allows the elbows to get away from the side of the body. This would be incorrect type of exercise. Additional type of problems are related to the type of exercises that the patient is given. For example, any exercises that involve raising the arms above the head, such as doing military or doing things such as bench press or push-ups, are the type of exercises that are to be avoided for patients who have head, neck, shoulder, and back postural problems. Additionally, the patient must always pay attention to how their shoulders function. Shrugging of the shoulders, raising of the shoulders, or pulling the elbows again away from the side of your body are going to cause worsening problems because they are now eliciting contraction of the muscles which require relaxation and not contraction. These muscles, particularly the muscles of your neck and shoulders, must be de-stressed. They must not be allowed to contract or to exercise in a manner that allows the posture to get worse.